Hi there, Mr. Gray. How are you? So it says here that today I'm going to come in, I'm going to get you up and moving, and I'm just going to screen your lungs and your heart before we do any sort of exercise today, and then after that we'll get you up and moving. Do you mind telling me about what signs and symptoms you have about your pneumonia?
I'm having some fever, chest pains, and some fatigue.
Okay. So kind of based upon like when I first walked in the room and based upon everything I've seen so far, I can kind of tell that you have a lot of accessory like muscle use in your upper back, specifically your trapezius muscles that are up here, along with you seem to be very short of breath and your position seems a little bit potentially a little bit hunched over in general, kind of making it hard to breathe to begin with. That could potentially be due to the pneumonia, not allowing your air to come out as smooth, causing you to be feeling trapped and congested like this. So I'll do some further screenings to help kind of rule in and out various conditions.
Okay.
Okay, Mr. Gray, to gain a better understanding of kind of where your pneumonia may be potentially located, I'm just going to take a listen at both your lungs, okay? Okay, sounds good. Okay, Mr. Gray, I'm going to be taking a listen to your lungs from your back, from the back of your body now. Okay, sounds good. Okay, Mr. Gray, based upon what I heard your lungs, everything in your lungs sounded normal, except there was a little bit of crackling on the lower left side of your, on the left side of your left lung, indicating that's kind of confirming with all the scans and testing we've done that has been done, that there is indeed that pneumonia down there. There's a crackling sound there as opposed to a normal, like, low-pitched kind of whistle noise that was found on the lower side, the lower part of your right lung. So, okay, thank you.
Alrighty, Mr. Gray. So what I'm going to be doing now for this assessment to kind of further assess your pneumonia is I'm going to be looking at the lower chest expansion, specifically on the lower region of where your ribs are. So right about here on you. I'm going to be doing that because your pneumonia is in that left lower part of your lung, which is where most likely, due to the fluid buildup and any other inflammation down there, that's where most likely where your chest is going to be limited in terms of chest expansion during max inhale and max exhale. So if you could go ahead and lift your arms up for me, that'd be great. Awesome. Come around, make sure this is nice and level. Okay, Mr. Gray, if you could go ahead and max exhale for me. Then max inhale. Okay. So, it looks like your chest expanded about 2 centimeters. So that's about a normal finding, especially in that lower left lung area of your chest, kind of indicating that your chest is still kind of, your lungs are a little bit congested with that current pneumonia you have.
Okay.
2, 1, go. Alrighty, Mr. Gray. Another quick assessment that I'm going to run here is I'm going to be measuring how much swelling there is in your feet. So what I'm going to go ahead and I'm going to touch the top of your left and right foot, and I'm going to check how long potentially the indentation on your skin takes. So check the left one real quick. Okay. Check the right one real quick. Okay. So after that, I'm going to give you a scale. It's on a scale of 1 to 4. I would grade you a grade 3 out of 4, meaning that you have about a 5 to 6 millimeter indentation whenever I touch the top of your foot, and then it lasts for generally about 1 to 2 minutes. Alrighty, Mr. Gray. So this right here is the modified dyspnea scale. It's a scale kind of basically whenever I ask you about it. So on a scale of from 0 to 10, 0, it measures how hard you're breathing during exercise. So for 0, it means you're not really breathing. You're not breathing hard at all during exercise. 10 means you're breathing as hard as you can during the exercise. So based upon whatever intensity of exercise, I'm going to ask you periodically kind of how you're feeling during the exercise, and then I want you to point out on this chart. I'm going to have the chart with me, and I'm going to tell you just kind of point out where it is or tell me what it is too.
Okay.
So how do you feel currently right now?
7.
7? Okay. Thank you.